Hi, welcome. My name is John Allen, and I'm host of Out in New Haven, where once a month we take a different topic of interest to the LGBTQ community in New Haven and Connecticut and explore it in depth. And today I'm delighted to be talking about LGBT health, medical health, and issues surrounding the health of our community. And I have a foremost agency in Connecticut dealing with LGBT health, the Hartford Gay and Lesbian Health Collective, and we have the executive director, Linda Estabrook. And thank you for coming here, Linda.
Thanks for having me.
Yeah,
I appreciate it.
And now we have this is a show about New Haven, but we have the Hartford agency here. But you really don't just specialize in demographically in Hartford. You really are covering people, anyone in the state can come to you.
Yes, absolutely. We, while most everyone comes from the greater Hartford area, we have people that come from New Haven and Bridgeport and Eastern Connecticut and Western and Northern Connecticut. So we're the only organization of our kind in the whole state. Right. So people
that's what
come
I
to
thought.
us, yes.
Yeah.
Yep.
And so why do people, why will they trek up to Hartford if they're in various corners of the state?
Because they figure we know what we're doing, and the word has gotten out that you can come to us. We're not going to judge you in any way in terms of behaviors, for example. And we're a welcoming place for people where they can be themselves. A number of years ago, one of the services that we provide is screenings, doing clinical breast exams for women, and referring them for mammograms if needed. And a number of years ago, there was a woman who was one of our clients, and we reminded her it's time for your mammogram screening. And she went off and she ended up finding out that she had breast cancer. But what she said to us was, I knew when I walked through the door, anything having to do with my sexual orientation, I didn't have to worry about explaining that to you. And I didn't have to worry about that piece of who I was. I just needed to be concerned about what was going on with my health. And so that's a really good example of what we're about.
You know, when I was doing some research for our topic today, I was just surprised that in all the literature that I was seeing, and they were talking about various ways that people can be sensitized to supporting the LGBT community and their medical health. One of them, one comment that really stood out is that people are discriminated against. Our community is discriminated against within the general medical population and service industry. Yeah. And so just that there was one study that said that 10% of all professional medical providers despise the LGBT community. And I think that number, whatever that number is, to think that a medical provider would discriminate actively and despise our community would really send shockwaves sends shockwaves through me.
Right. And I'm sure a lot of people hear the word despise and they go, oh, well, geez, that can't be. Well, it's true. Unfortunately, it's true. And it's a very scary thing in the health environment where you're already very vulnerable to begin with. If you're going to see a medical professional, going into the emergency room, whatever, for a problem that you have. And so it just exacerbates the concern and fear that you have about your own health, that you come out to that person and they're going to say, I don't need to take care of you. I'm not going to take care of you, or that you get poor health care because they really could care if you live or died.
Right.
We talked a few minutes ago about the Supreme Court decision today, right?
Yes, I know how serendipitous that here we are
Right.
talking about this, and the
Right.
Supreme Court just made that ruling about the baker,
Right.
the cake baker in
Right.
Colorado.
And so the concern that the LGBT community has around decisions like that is the decisions and work that's actually being done within the Trump administration right now to allow for legal discrimination in healthcare environments against LGBT people. Oh, it's against my religion to take care of you because you're LGBT. That's it shouldn't be. It's wrong and it shouldn't be. And so today's decision just, accentuates those concerns and those fears that the LGBT community has.
And some of the other things that were coming out of the reports from these medical websites is that our community experiences inordinate amount of depression. And that's related to feeling a sense of a vulnerable minority in the community, in the general community, and how that is, then turned into, if someone experiences discrimination. And let's face it, when you're not getting good care, or that somebody doesn't like you and is actually discriminating against you.
Right, right.
So and I wonder, is that a common thing that you do hear about from people coming in through the doors of the Hartford Gay and Lesbian Health Collective?
We hear a variety of stories and variety of concerns from people. We're not a mental health service agency, so we're not getting deeply into anyone's issues around depression or anxiety or various mental health issues, but if somebody's expressing some concern to us, then we make sure to refer them to an appropriate professional for the help that they need. One of the services that we provide, we function a lot like a community center social service agency, along with being a licensed medical facility and dental facility. So we get phone calls from people all the time, or people walking in the front door, and they're asking for information about various services they need, and some of those phone calls are for people that are looking for mental health services, counseling services.
Well, I think this is probably a great time to hear about what are the services that the collective does offer.
So our medical clinic is primarily focused on diagnosis and treating of sexually transmitted diseases, and something that may come as a surprise to the people viewing this is that sexually transmitted diseases are at the highest levels that they have ever been in this country. That applies to Connecticut. That applies to men who are having sex with men, very much so in the state of Connecticut, and it's syphilis and gonorrhea and chlamydia. And you got to be careful about all these things, and not just approach it like, oh, I can go in and get a shot or get a pill and get taken care of. Also, a lot of what's happening within our community is people are much more fluid now about their sexual behaviors, and so we're not just talking about men passing along an STD to another man. It's passing along to women that they're sexually involved with, and some of these STDs can be more hidden in women, and with syphilis, if you don't catch it like right off the bat, you're not necessarily knowing that you have it, but yet you can transmit it.
Oh my.
So that's, and again, the rates are, what we've experienced in our clinic is probably compared to just like 2 or 3 years ago, 3 times the number of positive tests.
And here, you know,
yeah.
you think that with modern medicine now that we were getting so good with eradicating all of these
Right.
concerns.
No, they've returned big time. Another service that we have is dental practice, and STDs get related to oral transmission of STDs, and so our dentist is finding those in people also. A lot of people with, we're a practice that's open to people who are living with HIV and AIDS, which is really important still these days because there are enough practitioners that are afraid of taking care of people in a dental practice with HIV and AIDS.
Because there's so much blood that comes
So,
out.
but you use the universal precautions and you do all those things that people have been trained to do for the last 20 plus years. So we accept all kinds of insurance and also cash, check, and credit card.
And that's a relatively new service for you?
Well, we've been providing dental services since 1997, and it was a few years ago that we expanded out to the wider community. I mentioned information and referral services. We're in the community center sense, we have different community groups that meet at the Health Collective. The 20 Club is a support group for transgender individuals.
And the 20 Club, you know, it's called the 20 Club because of what? Do you know?
The whole
The
chromosome
XX.
genetics and yeah, all that stuff.
And that's been a long-standing group.
Yes.
And you've just been now serving as the host of it for a
Yeah.
while?
Yep, for quite a few years now. Living Soulfully is a men's spirituality group. They meet in our space. We have a polyamory group that meets in our space. One of our programs that's related to HIV prevention is called Empowerment, and it's a social support group, educational group for young men who have sex with men. That's how the Centers for Disease Control, that's their terminology. Because, you know, some young men, this is young men 18 to 35, some of them identify as being gay or bisexual, but some don't. And so it's open to any young men in that
And
that
you
category.
also mentioned that nowadays it just seems that people are so fluid in their sexuality.
Yep.
And they may, you know, be experimenting or just have a very loose sense of identity.
Right. So, yeah, it's very interesting to how things have changed, you know, over the years. But just back to the services, we have a site in Manchester. It's called Health Collective East, and it's a service center for people living with HIV and AIDS, and it's a great opportunity for socialization and meals and medical case management services. Yep.
And so it's not every service is being done there. It's just mostly information, or is there medical related services going on in Manchester?
There aren't any medical related services. We're in the process of developing a schedule for doing HIV testing at the Manchester location. We do that testing in Hartford, and we're going to be starting to do that again on Wednesdays, I think, Wednesday afternoons.
Right.
Yep.
Now, I have not been in the Health Collective, but I do know the building because it was where the Hartford Gay and Lesbian Community Center originally was.
Right.
But yet, we were talking earlier, and you said that the collective has been around even before then.
Right.
So I wonder if you could tell a little bit about the history and how the organization came about.
So the Health Collective started in the fall of 1983, and the first program of the Health Collective was a series of workshops on a fall afternoon at Trinity College. The first workshop had to do with lesbian health. In February of 1984, our clinic started, and it was in the Thursday evenings, and we still have Thursday evening clinic.
Wow.
Started in the north end of Hartford at Community Health Services with Dr. Evans Daniels, and we were actually a volunteer program of Community Health Services. And we had our clinic there until the middle 90s, until we moved it to Hartford. And our first actual office was within the community center. We had one large room, and there were 3 part-time people working in there. And that office was in April of 1992. that we had our first office. And gradually over the years, with funding and program, we expanded. So, you know, we have the medical services and dental and various offices and that kind of thing.
Wonderful. Yep. And how many staff do you have there?
Right now we have 9 staff people. 7 are full-time, 2 are part-time. At any given time, we have around 100 volunteers.
Wonderful.
Who do everything from help out at the front desk during clinic, medical providers, volunteer nurses, HIV counselors, people who volunteer for fundraising events or volunteer at the reception office, volunteer putting together safer sex packets, variety of things.
Right, That's so necessary,
Yep.
I know. And how many people does the organization serve in the course of a year? Do you have some demographic information about that?
So in the course of the year, we touch probably 6,000 to 7,000 people. A fair amount of that is in our outreach activities, whether it be online outreach or in-person outreach. We're always out in the community at various events, like the Beer Bash at the Shea, and bringing our information. Online, we're utilizing Facebook, but also you know, Grindr and Adam for Adam of ways of connecting with people and providing, for example, HIV prevention information. And then if you look at some of the specific services, we're talking about 500-600 people in the STD clinic, and 300 plus people getting dental services.
Wow.
And depending on the program, the demographics are all over the place. If you look at our STD clinic, if you look at HIV testing, for example, it's like 90-95% are in the category of men who have sex with men, and they touch on all the various racial and ethnic demographics.
And men, women, people that identify as trans.
Yep. Yep, trans, heterosexual. In our dental program, there's more heterosexual people than gay people in the program. And again, depending on the program, 1%, 2%, 3% are transgender. We have a transgender resource person. I'm one of them, but also Diana Lombardi, who's with the Connecticut Trans Advocacy Coalition. She volunteers for us Tuesday and Wednesday afternoons, and fields voice messages and people coming in for services and emails and that kind of thing. It's a really good collaboration.
I know. I mean, you know, at the community center, the New Haven Pride Center, we field a lot of phone calls from people just that tend to be so hidden in so many regards, and they're just looking for resources and ways to connect with others, and for ways to connect in with medical providers that are sensitive to their concerns.
Yes.
And so that's great to know that you have that there, and it's robust.
Yeah, it is. Definitely.
That's wonderful. Well, you touched on a couple of the activities that you do, you know, some of the fun events that are going on in the center. And I know that you know, I think every nonprofit in the state is probably very jealous of your one big event, because I think that is the most successful, and it's just wonderful.
It is.
And what is that? You just have one big event a year, right?
We so for our 20th anniversary, we wanted to do a big event. We wanted to have some big celebration. It's something we'd wanted to do for a number of years, and so we planned this event, and it ended up taking on the name One Big Event. That's where that name comes from. And so it's in the fall of every year, and it's celebrating our anniversary every year, and it does raise significant funds for the organization. And as it grew over the years, we had to move into bigger and bigger spaces, and it's a fun evening, and you know, people get all dressed up, and just you look around the room and everybody's smiling. It's great.
Well, I think if anyone was ever looking for a way to emulate a successful fundraising event. That's definitely one to observe.
Well, thank you. So
Yeah.
people can come and observe on October 20th this year at the Connecticut
It's always in
Convention
the
Center.
fall.
Yes.
And
Yes.
on October, this year it's on October 20th.
Yes.
Mhm.
Yep. Yeah. So come observe. Buy a
Yeah.
ticket, come observe.
Right. Well, you know, we're speaking during June Gay Pride Month, LGBT Pride Month,
Right.
excuse me. And I know that you have an event that's coming up where, and there's many different Pride celebrations going on. And Connecticut's big Pride celebrations tend to happen in September around the state, although there is Triangle Community Center has theirs coming up in June.
Yeah.
And then it seems that Hartford, New Haven, and New London's Pride celebrations are in September. But you're having a beer
Tea dance.
a tea dance. Excuse me,
Yes.
a tea dance. And where is that going to be?
At the Shayest bar in Hartford.
And they've been very supportive of your organization as well.
Yep. Yep.
Yes.
And so this coming Sunday, June 10th, from 4 to 7 is a tea dance, and it's only $10 to get in and come and have a good time and you know, hang out with your friends, dance. Yeah.
Right.
Yeah.
Well, I wanted to know, what do you think is, you know, what is the sort of the direction that the LGBTQ health is moving in? Do you find that people are, you know, coming out more and being, I mean, are you finding, just what are you finding?
It's so interesting because a couple of months ago, it's like all over the place, okay? A couple of months ago, in one day, I got a phone call, and then a woman walked in. So a phone call from a woman, and a woman walked in saying that they both had been discriminated against in their workplace. And I thought the person who was walking in was the person that I had talked to earlier in the day. No, it was two different people claiming that they were being discriminated against, and so we needed to provide some information and resources for them. And so that's like related to the coming out type of thing, and or how you're physically presenting yourself. The kids. We have our annual queer prom. We've been doing our queer prom for 20 plus years now. And the kids are...
And a queer prom is what?
Oh, I'm sorry. The queer prom is for young 13 to 18-year-old kids to come, and their allies to come and be at a prom. And be able to be there with your boyfriend or with your girlfriend, and it's all mixed up.
With no stigma.
So they're exactly no stigma, and so these are young folks and just getting together and having a good time. The people while there are young people that are coming out younger and younger, whether it's, you know, lesbian, gay, or bisexual, but also transgender.
Yes,
and we're
I
talking
know.
about, you know, 4, 5, 6-year-olds that are coming out as transgender, but we're still getting the calls and getting the people that are coming in who are 50 and 60 years old, and they're lesbian, gay, bisexual, and transgender, and they're just coming out. So it's not like all of that has disappeared.
I know. Thank you for saying that. And I think that's a great way to say it, because you know, it's just, it seems like, you know, the more things change, you know, that it becomes easier for people to come out and be out. But yet, what we find at the community center is that there's still so many people that are calling, fearful of being out in their work environment, fearful of being out in family. They're still married to a spouse of the opposite gender. They have children, and they're fearful about coming out. I mean, it runs the gamut, and you just think that, well, you know, we live in such a you know, a great state and a great country to be openly LGBT, and yet we still hear these same kinds of horror stories.
Young kids getting kicked out of their homes, and you know, being threatened by parents, and so you know, coming out is still a big deal. It's still a big deal.
Right. And it's a big deal, certainly in the medical profession too. And I think that, this is something, I mean, I've been very fortunate that I've had the same doctor for over 30 years. My spouse and I both go to the same doctor, and we just think he's fantastic.
Right.
And he
Good,
talks to us
good.
about our issues that are specific to being gay men. And, so I haven't really experienced what that might be like to be discriminated. And plus I've been fortunate to be very healthy. So it's been, my connection into the medical field is much different than what
Right.
I do hear from
Right.
other folks.
Right, right. And that's
And plus,
great.
I think it helps to have good insurance too, right?
Right, and that makes a difference. And as insurances are changing, we're experiencing this where there are, co-pays where there used to not be co-pays, or there are higher co-pays and higher deductibles. And so people getting onto certain medication programs, it's not necessarily, it's not being covered the way that it used to be. A lot more of those costs are being passed on,
Right.
to and even through employers and all that.
Now, if somebody doesn't have insurance, are they still welcome to come in, or how do you accommodate them?
So in our medical program, we do not bill any insurances at this point in time. We do charge a fee for services, but we don't turn anybody away because they can't pay that fee.
Well,
Yeah.
that's good to
Right.
know.
Right.
And in our remaining moments, I can't believe we're coming to the end of our time, but is there something that, what do you see on the horizon for the Hartford Gay and Lesbian Health Collective?
Well, one of the things that we're involved with, that actually I'm involved with, is the Getting to Zero Commission with the state of Connecticut, and it has to do with getting to zero HIV infections, zero deaths, and zero stigma, because there's still a lot of stigma around it. And it took a little convincing for me to be a very supportive person when it comes to PrEP, which is the pre-exposure prophylaxis, which for someone who's HIV negative, it's a medication that you can get on that can keep you negative. And then if we find all the people that are HIV positive and get them into treatment and on medication, you can actually make your way to zero, and that would just be amazing. Doesn't even begin to cover it.
Right. Well, that's so great.
Yeah.
Well, Linda, I thank you so much for coming down and talking about LGBTQ health. I really appreciate it, and best of luck to your organization.
Thank you so much.
And I'm John Allen. I'm the host of Out in New Haven, and we've been talking with Linda Estabrook, from the executive director from the Hartford Gay and Lesbian Health Collective in Hartford, and they serve statewide. So until next time, thank you.